A UTI, or urinary tract infection, is an infection in any part of your urinary system and can cause a lot of pain for the person experiencing it. We sit down with Dr. Ali Fayed of Internal Medicine with Community Health Partners to answer your questions on urinary tract infections in men and women. It's no secret women are more likely to experience a UTI than men.
The females, they have like a shorter canal that connecting the urine from the bladder to outside, so they're more likely that the infection can get to their bladder more than the guys. A lot of times ladies, when they have their periods or something like that, they, because of the change sometimes in the bacteria that lives around this area, it changes, so it starts like attacking their urethra and urinary bladder, so they get urinary tract infection. Sometimes people, when they have no good hygiene, so that sometimes they have that. Unfortunately, some of the older ladies, as they go into menopause and so on, because they don't have as much estrogen and so on in their system, so there is a little bit of dryness in the vaginal area and the vagina surrounding the urethra, and that just makes it more likely to get like invaded by different types of bacteria.
However, males should be aware of the risk they face of infection as well.
When a male gets an infection, it has to be taken a little bit more seriously, and the fear is primarily for just having a residual infection, mild, low-grade infection that just sits in the prostate, and prostate inflammation and infection can be a serious problem, can be a chronic problem afterward if it doesn't get addressed correctly.
Infection can range on various levels in males and females.
Can be in the urethra, the anterior urethra, which is the canal that connects the urine from the bladder to outside. It can go into the actual bladder, and for male it can also get into the prostate, and then it can go up to the other collecting system, what we call the collecting system, mean their ureters and their kidneys, and that the more serious type of urinary infections, because typically patients, they will have high fever, they will have abdominal pain, they can be feeling sick, and sometimes the infection can spread to their blood.
With common over-the-counter medications available, Dr. Ali Fayed says to seek treatment if you feel yourself experiencing persistent symptoms of a UTI.
If the symptoms are just last over 24 hours, it would be much better to contact your healthcare provider just to get maybe evaluation or to get some antibiotics or treatment for that.
However, if you're experiencing UTIs frequently, Dr. Fayed says to take action by talking to your healthcare provider.
We see a lot of resistant strains of bacteria for antibiotics. So patients typically, oh doctor, I took my antibiotic that you gave me, but I still have the same symptoms. In this situation, it'd be probably better for the patient before taking antibiotic to run a urine culture.